All right, today we have Anton Atanui, who is a 17-year-old male in a senior year of high school who reports not being able to catch his breath in gym class. He describes this as a shortness of breath and chest pain that increases when running around the gym. It feels like a tight squeezing pain in the center of his chest that sometimes goes away with rest. Sometimes he can hear himself breathe. He has been experiencing these symptoms intermittently for the last 4 years since moving to Kansas City. He's never taken anything to relieve his symptoms, and his symptoms are worse in the early summer and early fall. They're also present at home, and they're worse when he's coughing at night. He says, again, he can hear himself breathe sometimes. And please note the physical exam was positive for expiratory wheezes. Past medical history, he's had no surgeries. He sprained his ankle when he was a freshman playing basketball with his friends, who were braced for 4 weeks, healed on its own. He's had multiple episodes of croup, according to the mom, and ear infections as a child. He did have a recent viral illness with low-grade fevers that resolved 1 week ago. Again, his family history, his mother is healthy but has had a chronic rash for years that's like itchy and scaly, mainly on her arms, where her arms and legs bend. His father has asthma and COPD, does smoke cigarettes, but he does not smoke in the home. He has 2 siblings, a 14-year-old brother, 12-year-old sister, who are both being treated for asthma. The maternal grandfather is deceased at age 45 from a heart attack. Social history, Anton identifies as Chuukese, and he identifies as cisgender male, XY. He lives with his mom and his 2 younger siblings in a rented home in Arborvale. That home is 30 years old, and his previous owners did have 2 cats and 1 dog in the home. Arborvale is notable for a history of airborne pollutants and is not far from a rail yard. He attends Wyandotte High School. His mother and father are recently divorced. He stays with his father every other weekend. His mom works in a factory in Fairfax district of KCK. He reports no ethanol drug use, but does vape with his friends. He's trying to cut back. His breathing is worse when he's vaping. Please note when talking to Ms. Atanui, she does have questions about the local pollutants and whether this could have contributed to his asthma, and she's also asked about how to perform air quality testing in her home. So that's something important to note. So physical exam, normal, febrile, or normal, yeah. He no fever at 36.8. Blood pressure is 110/60. Heart rate 64. Respiratory rate is 20. In general, he's alert, oriented, no acute distress. He is normal cephalic and has some conjunctival erythema. Tympanic membranes clear. Bilateral nares with body terminates. Posterior oropharynx clear without cobblestoning. His lung exam, as I mentioned, expiratory wheezes heard throughout. No crackles heard. Deep inspiration does elicit a cough. And some slight wheezing. No notable rales or bronchi that I could hear. Forced expiration does make them louder. It does make his expiratory wheezes louder. And there's minimal use of his accessory muscles of breathing. His heart had a regular rate and rhythm, no murmurs. His abdomen had normal bowel sounds, soft, non-tender, non-distended. His extremities showed no clubbing. Radial pulses were normal, and there was no edema. His skin is intact, no rashes or lesions, and his neuro exam was non-focal. And we were able to get a CBC. So his white blood cell count was normal at 8.2. His hemoglobin is normal at 15.2. He did have some eosinophilia at 8%, and his platelet count was normal at 280,000. Thank you. Chest x-ray was also done and appeared normal. So my assessment, given his family history and his history of present illness, I am most suspicious that Anton is suffering from asthma. From the sound of it, it is limiting his activity, which makes that qualify for moderate to severe, as well as some nocturnal awakenings. But in order to really nail down that criteria, we're going to have to ask him a little bit more detailed questions. Other possibilities could include a hypersensitivity pneumonitis, which could be a result of the exposure to pollutants we know is around his home. And this could be ruled out via CT because it can be missed on x-ray. a high contrast CT, not low. And then other possibilities could be, it could be a mild form of cystic fibrosis that wasn't caught in his childhood. This can be ruled out by looking at his newborn testing screening if he got that, or it can be done via sweat chloride test. This is less likely, as these symptoms would likely be secondary from a infection, which we would see on a chest x-ray or in his white blood cell count. So unsure. It could be another congenital, rare illness like alpha-1 antitrypsin, homozygous for that, or could be another congenital thing that we're missing. I am less suspicious for that because of how suspicious it looks for asthma. So I think the plan, please note that the plan is, we're waiting until we're going to discuss it with his parents. His parents are uninsured and the patient is on Medicaid. So this is the initial plan before negotiating with the patient was, the patient's parents, what is affordable for him and them. First, I'd recommend some PFTs to make sure he's above 60% FEV1. Just confirm his severity, that he's not in his, extremely severe, and to confirm the treatment path we want to take forward. I would like to do some skin print testing, just because he has a family history of atopia, to see if he's allergic to anything, if there's any triggers we can control in the future. I would love to get some IgE levels, again, to see how severe it is, to rule out hypereosinophilic disease, and again, to see if he's possibly a candidate for monoclonal therapy as he is an adolescent, and if this asthma is severe, or if this asthma goes uncontrolled, we would really want to add that on sooner rather than later. Again, we want to work with mom to test air quality and possibly work with partner with a social worker to see possible solutions to that, because we don't want to do a test that's not going to have a possible solution if it does prove that he has poor air quality in the home. Again, after asking more questions about the severity and frequency of these symptoms, I think the child would likely benefit, or this adolescent would likely benefit, from low-dose ICS formoterol as maintenance and reliever therapy, which is the preferred treatment for someone meeting mild or moderate to severe asthma in adolescents. Thank you so much.